More than 80,000 people will be told they have non-Hodgkin's lymphoma this year. It's a cancer of the white blood cells in our bodies. There are more than 60 types of NHL, and it can be difficult to treat. But now groundbreaking new treatment could change the game for cancer patients. Marty Salt has the details.
Brooke Michael, number 12, has been a catcher for as long as she can remember.
I've loved it ever since I put the gear on for the first time.
Her mom and dad have watched every battle on the field and were concerned when Brooke's shoulder started hurting her.
She called me one day when her and her sister were at pitching practice, and she was in tears saying she couldn't breathe.
Brooke was diagnosed with B-cell lymphoma.
She had a massive tumor on her chest. It literally was the size of a softball.
6 rounds of chemo and 29 rounds of proton radiation helped to shrink it, but the cancer was still there. That's when doctors at Nemours decided to try a combination of gene therapy and immunotherapy called CAR T-cell therapy.
For the children who are getting CAR T, it's kind of the last curative therapy.
T-cells, which are a type of immune cell in the body, are taken from the patient's blood. Using gene therapy, doctors reprogram the cells to attack cancer cells.
And so those cells go in the body and they proliferate and start to divide and attack any residual leukemia cells.
Studies show that up to 40% of the children who get it go into complete remission. It worked for Brooke. 1 year later, she's back in the game, cancer-free.
It's just the best feeling, being back on the field.
We were days away from losing our daughter, and now we're just back to watching her on the softball field.
Marty Salt, 16 News Now.
And the new cancer-killing CAR T cells stay in the body for months, maybe even years, to provide long-term protection. We'll be right back. Stay with us.